Myofunctional therapy is quite a new concept for a lot of people. Even myself, like last year, I didn't even know what it was until I did the course. But in simple terms, it's just talking about the muscles around the face and the mouth especially, and how the correct muscle forces will promote good growth and development, especially in children. But what we're seeing now a lot is if you have the incorrect forces, so you're doing different movements with the muscles, how that actually can move teeth and cause the development of bone to develop in not an ideal way. An example of that, for example, is if we see a child and they have like a really strong tongue thrust. So the tongue is pushing out against the teeth. The tongue is usually supposed to sit on the roof of the mouth. So if they're constantly tongue thrusting, they're going to move. That pressure of the tongue is going to move those teeth. So then you're going to have misaligned teeth and then a problem. So we're looking at all those things when kids come in now. Even our assessment starts when kids just walk straight through the door. I know that sounds really odd, but it's instead of just coming to the dental chair and just looking at the teeth, we're looking at more than the teeth now. A really good example, it happened just the other day, a child walked in and as soon as they walked into the surgery, they just had their mouth open. So they're mouth breathing and we're thinking straight away that's a red flag. Why are they mouth breathing? Can they not breathe through their nose? So straight away we're thinking of these things and we haven't even got them in the chair yet. So why that's important, because a lot of people might think, what does it matter if they're breathing through their mouth? When you breathe through your nose, so nasal breathing, which is the correct way of breathing, your tongue sits on the roof of your mouth. And the pressure of the tongue on the roof of your mouth helps form the correct arch and wide arch of your upper jaw, so your palate. So if you see someone mouth breathing a lot, the tongue is sitting low, and therefore you don't have that pressure on the upper arch. So what you'll find with these kids is they'll have high arched palate, and if they have a high arched palate, that means their upper jaw is underdeveloped, which means they have loss of space, which means then they have crowding issues. And straight away, this is very likely will turn into an orthodontic case. So where the myofunctional therapy comes in is that a lot of times you might hear that people will have braces or orthodontic treatment, and then you'll hear, oh, they had to do it again. They had to do it 2 or even sometimes 3 times. So you can get the teeth aligned beautifully, but if the muscles are still doing the wrong things, it's going to relapse. So if a patient continues to tongue thrust after you've had the braces and you've got the beautiful straight teeth, the teeth are going to move. Some people have a lateral tongue thrust, so they get like the side movement and they get what's called a crossbite. So there's so many things that can happen just with the tongue alone. Even cheek movements, if they don't have correct lip seal. So we're looking for those things in kids. It is important to know that sometimes it's not as easy as just going, oh, close your mouth, breathe through your nose, that'll solve your problems. So we have to look and investigate beyond that. So sometimes, for an example, we'll try and ask the parents, like, why can't the child breathe through their nose? Or why are they mouth breathing? And it could be something like they have large polyps in their nose, or they have a deviated septum, something like that. So sometimes it does mean we have to send them off to the GP and just check for things. Another good example is a tongue tie. So if you say to a patient, a child, look, we really want you to be nasal breathing, so stick your tongue to the roof of your mouth and breathe through your nose. If they have a tongue tie, they physically can't get their tongue to the roof of their mouth. So we're checking for those things in our dental examination now. So if they have a tongue tie, for example, that's a time when we would send them off or address that first to release the tongue restriction so that they can actually lift their tongue up. So it's a little bit more complex, but there's a little bit more to it. So that's how the myofunctional therapy and the orthodontic kind of work together. Because I see a lot of children patients, a big thing that was a reoccurring theme was patients were saying that they were grinding a lot, or the parents were saying, my child is grinding a lot. And back in the day, we were sort of taught that this is normal, like they'll grow out of it. But Dr. Karuna was like, this can't be normal, we're seeing it so much, there must be a reason. And then we found out about the course about myofunctional therapy and sleep problems and sleep apnea and all that sort of stuff. They're all tied together. And so we went along to some courses, and it turns out that grinding is not normal and that and there's all these links to why people will grind, and one of the biggest reasons is they're clenching to try and open an airway and to breathe better. So now when we see kids, if they're clenching and grinding, we're immediately thinking there's something we need to look for. That's how we got into looking a little bit more, because we're finding out that patients were having a lot of trouble, they're grinding all their teeth down, we're thinking this can't be normal, it's happening more and more and more. It's really great, and it's really good to hear feedback, especially when, say we've identified a tongue tie and we've identified that the child can't sleep really well, and once they go and investigate it and they're like, oh, you know what, they had really large tonsils that were obstructing their airway and they had the tonsils removed, and then the parent's like, you know, they're sleeping better now, they're not snoring, their behaviour's changed at school, the teachers are saying, you know, they're not sleepy at school. And it's a friend of mine, her child was always getting in trouble for being like sleepy and non-attentive, but he was just tired, you know. And so sometimes when people come in and they're like, why are you asking us all these questions about how my child sleeps? It can have not only an effect on your teeth, so stopping grinding and stopping hurting your teeth, or grinding down your teeth and cracking your teeth, but your overall health, you know, how you do well at school, your attention span, that sort of thing. So it's really rewarding, yeah. We still see adults all the time. We just want to try and focus on prevention. So if we can get them early, then if we fix the tongue tie, speech problems, because that's a big thing that happens with tongue ties, we get it early and we try to change their life earlier. So we do target kids a lot, but we see adults all the time and we're sending them off for, you need to go check your nose, you need to go check your tongue, we need to figure out what's going on here, and then their life gets better. So a big one is once they're able to breathe through their nose better, they're not snoring, their partners are happier, they're not grinding and cracking their teeth. So yeah, all ages is still something we focus on, yeah. Because there's so much information, and I think we're all really enthusiastic about it, so we get really excited and the parents are like, oh, that makes sense. And that's the best part, it actually makes sense. So when you have to have the time to explain it to them, because once you explain it to them, then they're like, oh, they can connect the dots and it all makes sense. Once upon a time, orthodontics was all about just making the teeth look pretty. People just wanted straight teeth, and that's obviously important as well. But now we want to do orthodontics in a way that's going to promote the best health for the patient. So you don't want to put the teeth in an alignment which is then going to collapse the airway and then people are going to have trouble sleeping. So we want it all to promote health.